I just want to discuss about a patient who presented to me after noticing a slow pulse rate on his smartwatch. So in such patients, sometimes smartwatches also can give false signals or false sensing. But we have to go in some detailed history, like whether patient is an athlete and having good physical fitness. Lower heart rates like less than 60 per minute can be normal for them. And patients who are hypertensive and on beta blockers like metoprolol or bisoprolol, they can have lower heart rates. And ask for some important history like warning symptoms like chest pain, palpitations, sweatings, dizziness, breathing difficulty, lightheadedness or fainting episodes. So in such patients, we have to take a detailed cardiovascular examination. We have to admit them, start from ECG and 2D echo, sometimes angiogram. So other causes of asymptomatic or without any symptoms and lower heart rates are like apart from drugs like beta blockers, digoxin, and physical fitness, are obstructive jaundice, like patients who are having high levels of direct hyperbilirubin in the blood because of biliary obstruction. They can have lower heart rates. And patients with uncontrolled hypothyroidism, like a TSH very high, and who are not on medication, they can have lower pulse rate. And patients with high potassium in the blood, especially we see in chronic kidney disease patients, they can have lower pulse rates, and we have to treat. And other things like patients who are on in living in very cold climates like hypothermia can cause lower pulse rate. So whether patient is symptomatic or not symptomatic. So if symptomatic with lower heart rates and ECG showing some degree of heart blocks like second, third degree advanced heart blocks, we have to do some temporary or permanent pacemaker implantation and treat the primary cause, like be it a block in the blood vessel, like doing stenting and treating the medical problem like hypothyroidism, obstructive jaundice, or high potassium levels, treating with sometimes dialysis and all. So in asymptomatic patients or who are not symptomatic and having low pulse rate, we can ask them to do some activity like ask them to run for a few seconds or do some squats. If they achieve heart rate like 100 per minute from 60, or 85% of their maximal predicted heart rate, that is 220 minus age in years, so then there is no chronotropic incompetence. Then heart, that means the heart muscle and heart nerves are adapting normally to their fitness level, and there is nothing to worry, and patient can be reassured. Thank you.